Hi everyone, this is Dr. Priyadat Patel, your go-to gynecologist from Balaji Horizon Women's Hospital-Ahmedabad. To continue the discussion of endometriosis, when patient is been diagnosed with endometriosis, generally they present with few of the symptoms, or in a reverse way, what kind of a symptoms you can expect when you have a endometriosis. In our previous video, you understand the causes, types of endometriosis. They are basically important to understand. Why? Because symptomatology is mainly related to that, and this symptomatology is mainly divided into three parts. One of the three most common symptoms of endometriosis is number one, pelvic pain, number two, infertility or fertility problems, and number three, menstrual irregularities. So let's understand pelvic pain, why it occurs, what is the reason behind it in endometriosis, and what kind of a pelvic pain you expect to have a endometriosis. So make sure this is very clear that if you have a pelvic pain, that doesn't mean you always have a endometriosis. But the reverse part is comparatively not, we can't say that it's true, but it is mainly there that if you have a endometriosis, there is a possibility you have some or other variety of a pelvic pain. So what kind of a pelvic pain you expect during the your life with the endometriosis, or when you affected with the endometriosis? So mainly it is divided into the two parts. First is very important, that is pain during, just before or just after the menstruation, which is called as a dysmenorrhea. So when patient is having a period, जब भी periods होता है तब severe pelvic pain होता है, and that is one of the most common symptom of endometriosis. ये क्यों होता है, किस तरह होता है? Because generally what happen is this shedding process में, period के दौरान endometrial shedding जब होता है, periods के दौरान जब endometrial lining बाहर आती है, उसी तरह same endometrial tissue has been degenerated and shed over the local area where it is implanted in cases of endometriosis. And with this shedding वो एक तरह का chemical reaction produce करते हैं, उसकी वजह से local inflammation होता है, tissue scarring and adhesion formation होता है, and that can cause further chemical release which produces severe pain. Second type of pain is generally takes place when there is a more involvement of the endometriosis into the pelvic structure. Continuous dull aching pain patient feels. We call it a lower abdominal heaviness or continuous dull aching pain. If deep infiltrating endometriosis is there, patient can have a pain during the sexual activity also, which is called as a deep dyspareunia, which is also kind of specific to the rectovaginal septum involvement or a kissing ovary in cases of endometriosis, but it's not always so. When endometriosis affect the bowel, particularly with the bowel involvement or external bowel involvement with adhesion formation, with bowel movement also patient feels the pain. These pain are generally colicky in nature, severe in nature, and comes in peak. If it affects the ureter and bladder involvement, then the symptoms are related to that only, and sometimes they produces bleeding during the defecation and urination also, which is not that common, but we are seeing in OPD few of the instances. Second symptoms of endometriosis is period irregularity. A period irregularity is not universal in all the patients, and it is not always presented in a similar manner. Few of the patient can have a heavy menstrual bleeding, few of the patient can have a polymenorrhea, that is a recurrent bleeding at a small interval. Few of the patients have a prolonged periods also. So it is very difficult to predict which kind of a period irregularity can be there in patients of endometriosis, but it is mainly related to the hormonal imbalance which is produced with the involvement of the ovarian tissue and surrounding structure. But mainly in our OPD, patient present with endometriosis, and that is one of the most presented symptoms of endometriosis, is fertility issues or pregnancy problems or infertility. So why infertility and fertility problems takes place in the cases of endometriosis? Because it generally alters the function of the reproductive organ. So wherever it is implanted, it produces inflammation, scarring, adhesion formation, and interfere with the normal function of the reproductive organ. Along with that, few of the hostile environment as far as chemical level is concerned may develop that might be responsible for the fertility issues due to ovarian involvement, the oocyte quality, quantity, tube-ovarian relationship, pain during the ovulation, pain during the sexual intercourse might play a role. Anatomical alteration due to adhesion formation, scarring, fibrosis may be responsible for the endometriosis induced fertility problems or infertility. But हमेशा ऐसा नहीं होता है कि आपको endometriosis है तो हमेशा pregnancy में issue रहेगा ही या fertility issue रहेगा ही, because out of not 10 but we can say 15-20 pregnancy or once in a while every week we are seeing one patient who is pregnant and she is diagnosed on first sonography of the pregnancy itself that she is having a ovarian involvement of the endometriosis or a endometrioma. So to tackling down the each symptoms of endometriosis is not universal. It is basically a tailor-made. It varies from patient to patient with the same finding depending on her situation, requirement, and at what stage and type the endometriosis is. So if you have any queries regarding the symptomatology of the endometriosis and its outcome, you can contact your healthcare provider or us. This is Dr. Priyadat Patel, your go-to gynecologist from Balaji Horizon Women's Hospital, Ahmedabad.